Disease key recommendations: chickenpox, varicella offer test to all healthcare workers, HCWs, unless known to be immune, migrant women of childbearing age, immunocompromised individuals and their household contacts. Vaccinate non-immune HCWs, non-pregnant women of childbearing age, healthy close household contacts of immunocompromised individuals. Some immunocompromised people may be vaccinated, for example those with lymphocytic leukemia in remission, transplant recipients, and some children and adults with HIV infection. Offer varicella zoster immunoglobulin, VZIG, to non-immune women who have been exposed to varicella or zoster during pregnancy as soon as possible after exposure and ideally within 96 hours. Specific neonate groups, see Section 5.1. Specific immunocompromised individuals, see Section 5.1. Hepatitis B offer test, HBsAg and anti-HBc, to all new migrants originating from countries with a HBsAg prevalence of greater than or equal to 2%, household and sexual contacts of identified acute or chronic cases, all women attending antenatal services, sex workers and those who have been trafficked, people who inject drugs, PWID, men who have sex with men, MSM. Vaccinate all infants according to the routine childhood immunization schedule, 6 in 1 at 2, 4 and 6 months. All children age 12 months to 10 years according to the late entrants catch-up schedule. Vaccinate if non-immune, vaccination not required in anti-HBc positive, all migrants originating from countries with a prevalence of greater than or equal to 2%, children born to parents from countries with a prevalence of greater than or equal to 2%, persons at risk of occupational exposure to blood or blood-contaminated environments, household and sexual contacts of persons with acute or chronic infection, families adopting, fostering children from countries with a prevalence of greater than or equal to 2%, babies born to mothers who have HBV infection. They should receive a complete course of vaccine at 0, 2, 4 and 6 months, and also HIG within 24 hours of birth, and have serological testing 2 months after vaccination completed. HIV-exposed and HIV-infected infants should be given hepatitis B vaccine at birth and then continue with the routine childhood schedule. Sex workers and those who have been trafficked, those deemed at risk following an assessment of their health needs PWID and their contacts, refer all HBsAg positive cases to specialist services for review. People who are HBsAg negative, anti-HBc positive should be referred for specialist care if they become immunosuppressed, including that due to chemotherapy or transplantation. Hepatitis C offer test for anti-HCV to all migrants who originate from countries with a prevalence of chronic hepatitis C of greater than or equal to 3%, those with a history of hepatitis C risk exposure behavior, including people who inject drugs, PWID, and men who have sex with men. MSM offer test for HCV RNA, all those who have a positive anti-HCV result refer all positive cases to specialist services for review. Vaccinate those who are non-immune to hepatitis A and or hepatitis B with hepatitis A and or hepatitis B vaccine. HIV offer test for HIV AG, AB2. All women attending antenatal services, all those with risk factors for HIV including but not limited to from high HIV prevalence countries, 1% concurrent sexually transmitted infection, people who inject drugs, PWID, sex workers and those who have been trafficked, men who have sex with men, MSM concurrent TB infection refer all positive cases to specialist services for review. Intestinal parasites, helminths offer test, ova, cysts and parasites, to symptomatic migrants only, particularly those who have lived or traveled in endemic regions, migrated from Southeast Asia or Sub-Saharan Africa. Eosinophilia note: healthcare professionals should also be aware that those with concurrent immunosuppression are at increased risk of developing disseminated parasitic infections, especially strong alloids, as this auto-infects and disseminates widely in those who are immunosuppressed. Note: a raised eosinophil count, 0.4 by 109/L, may be the only indication of a parasitic infection. Malaria offer test, thick and thin malaria films, to symptomatic migrants only, particularly those who have fever, lived or traveled in malaria-endemic regions within the previous 12 months, particularly in sub-Saharan Africa. Refer all positive cases to specialist hospital services for review. Measles. Assess all migrants for previous measles vaccination. Vaccinate, MMR, all children according to the routine childhood immunization schedule at 12 months and 4-5 years of age. 2 doses. All others according to the late entrants catch-up schedule for children and adults, as follows: 12 months to 4 years, 1 dose MMR, second dose at 4-5 years old, 4 years to 18 years old, 2 doses MMR at 1 month interval, adults aged 18 years and older, 2 doses MMR at 1 month interval. Polio. Assess all migrants for previous polio vaccination. Be aware that acute cases of polio can present from countries where polio is endemic. Consider post-polio syndrome in patients who may have been infected in childhood. Vaccinate all children according to the routine childhood immunization schedule, 6 in 1 at 2, 4 and 6 months with a booster dose at 4-5 years old. All others according to the late entrants catch-up schedule for children and adults, as follows: 12 months to 4 years, 3 doses of 6 in 1 at 2-month intervals with booster at 4-5 years old. 4 to 10 years, 3 doses of 6 in 1 at 2-month intervals with booster dose at least 6 months and preferably 3 years after the primary course. 10 to 18 years, 3 doses of DAP-IPV at 1-month intervals with booster dose 5 years after primary course. 18 years and older, 1 dose of DAP-IPV followed by 2 doses of TDIPV at 1-month intervals. 6 in 1, DAP-IPV/HIB/HEP. DAP-IPV, tetanus, reduced dose diphtheria vaccine, reduced dose pertussis vaccine. IPV/TDIPV, tetanus, reduced dose diphtheria vaccine. IPV. Rubella. Offer test for rubella immunity to all women of childbearing age. Vaccinate, MMR, all children, 2 doses. Non-pregnant seronegative women of childbearing age, 1 dose. Non-immune healthcare workers, 1 dose. All children and non-pregnant adults from low-income countries, without documented evidence of rubella vaccination, should be offered 1 dose of MMR. 2 doses may be required to fully protect against measles and mumps. Sexually transmitted infections, STI, offer testing. All sexually active people who are from countries with a HIV rate of 1%, available from apps.who.inc web link, should be offered a full sexual health assessment. A high HIV rate in a country can be taken as an indicator of likely high rates of other STIs as well. The following sexually transmitted infections should be screened for at a minimum in sexually active asymptomatic individuals from these countries: serology for HIV, syphilis, serology urinary nucleic acid amplification test, NAAT, for chlamydia, trachomatis and syringonorrhea. Sexually active people who are from countries with an HIV rate of less than or equal to 1% should be offered sexual health screening as appropriate for their sexual history. All people with symptoms of an STI should be offered a clinical assessment, STI testing and treatment. Further information on what is involved in a sexual health assessment can be found at the British Society for Sexual Health and HIV website, www.bash.org. Offer vaccine, human papilloma vaccine, HPV, females at 12-13 years of age as part of the National Vaccination Program. HPV vaccine may be given to females aged 9 to 26 years. Vaccination with the quadrivalent HPV vaccine should be considered for HIV-positive males and females from 9 to 26 years. Hepatitis B should be considered as per Section 5.2 Health Promotion. All sexually active people. This should include safer sex and contraceptive advice for both males and females and information for women about cervical screening. Refer to STI services if more specialist services are required. Tuberculosis risk. Assess all migrants from countries where prevalence of TB disease is known to be change greater than or equal to 40 cases per 100,000 population as per the National TB Guidelines 2010. See Appendix F for a list of THESA countries. Follow the TB disease algorithm.